Good morning, I'm Kurt Caraway and this is Our Town at Comma Coffee. This morning we're going to be talking with DeeDee Foremaster from the Rural Center for Independent Living that provides services for people in need. But right now we're going to take a short break for a word from our sponsor.
The new year is here, and with it an opportunity to take charge of your health, your well-being, your future. That's where we come in. At Carson Tahoe, we created an interactive website dedicated not to your illness, but to your health. Because as much as we care for our patients, your everyday health is even more important. Are you ready to live healthier? Start today at herestoyourhealth.net, a free service of Carson Tahoe Regional Healthcare.
And we're back. We're talking with DeeDee Foremaster. How are you doing this morning?
I'm doing great.
All right. Well, tell people a little bit about what Rural Center for Independent Living is, about what you do.
Well, the Rural Center for Independent Living actually provides services for people with disabilities and people who are on the streets with disabilities. As you know, as we had been talking about, over 65% of the people who are on our streets today are people with disabilities. And what we do is provide services for them, like housing. We help them fill out the paperwork for food stamps, for energy assistance, for paperwork that you actually would do for the deposit paperwork program, also rural housing paperwork for housing. And those are just some of the services we provide with our CIL.
Okay. And I mean, you know, Carson City has had somewhat of a problem with people being homeless, but you know, you've been out here for 11 years now, I think it is, you said?
It's, yeah, 12 actually.
12 years. You know, helping those folks out and getting them back on their feet and things like that. So, and then also the Do Drop In, explain that was a little bit...
Yeah, that's, the Do Drop In is actually inside of our Center for Independent Living, and we provide things like coffee. If someone is disabled and on the streets and actually needs assistance, they can come into our center. We do have actually a hospitality center in the back section of our office where we provide coffee, pastries, which are donated by Starbucks.
All right.
We really, really appreciate that. And also, all of our salads and sandwiches that help people be able to get a healthy bite to eat are provided by Trader Joe's. And they're all prepackaged and ready to go. So we also have a microwave and a toaster in the back that allows people, if they want to bring in their own TV dinners or something like that from their food stamps, they can prepare their own food there.
Yeah. Now, mention where your center's at.
It's actually on the corner of East Long and Humboldt.
Okay.
We're right behind Napa Auto Supply, which is on Highway 50 there, so we're on East Long. Okay.
And how many people do you serve, you know, in a normal day?
About between 15 and 20 people a day, depending upon the weather. When the weather is colder, we get a higher increase of people coming in. When it's hot, people also, there's a big increase of people coming in.
Okay. Where they can kind of take a little bit of shelter.
Yeah. And it's a safe place where they can actually rest. The drop-in center, we have chairs and sofas in the back that actually allow people to have a safe environment to be able to close their eyes and rest, because most of them walk the streets at night.
Okay. Well, right now we're going to take a short break and come right back after a word from our sponsor.
At Carson Tahoe, each of our 1,100 professionals brings something special to this region.
My compassion.
My experience.
My skill. My knowledge.
My commitment.
My expertise.
My dedication.
But we all share one common goal.
Your health.
Carson Tahoe Regional Healthcare. Here's to your health.
And we're back and we're talking with DeeDee Foremaster, and let's talk about some of the center that you have that's doing this work, the needs that you have to help the center do this work.
Actually, the Center for Independent Living, surprisingly enough, is ran by all volunteers.
Wow, okay.
None of us are paid there in the office.
Huh.
We actually come in to try and help the people in our community who are less fortunate. So one of the things we can always use is volunteers. The other thing that we can always use is supplies for the center. We use mostly paper goods like paper towels, napkins, paper plates, paper bowls, plastic silverware. Toilet paper is a big commodity. And also food. If you want to donate canned food or packaged food, that we do have a small food pantry there that we do assist people once we get them into housing and off the streets. We assist them for a while so that they can actually be able to get by on their small Social Security checks, so we do have a small food pantry. Also, some of the things that we need are kitchen supplies, like what you would use if you moved into a home.
Okay.
Pots and pans, silverware, dishes, things like that anyone could use that we are actually placing into an apartment.
Okay.
Beds also are something that we have a big need for, because when you place someone in an apartment, there's absolutely no furniture.
So you got to have something to do, right?
Yeah. And so our policy at our center is that once we get you off the streets, we demand that you give back to your community, whether it is volunteering at the local senior citizen center or at FISH or at one of the other nonprofits. Sometimes they circle back and also volunteer at our center. But we ask that people please give back and please help others so that people pay it forward.
Oh, there we are. That's great. Now, you're helping people, not just people who are on. People get off the street, and you say, you have some success with that. You were just saying you just placed some people last week, or? Yes, we
place anywhere from about 2 to 5 families a week, and actually get them off the streets into stable housing. Once people are in stable housing, they're more apt to access services easier, like for instance getting to doctor's appointments, mental health clinics, getting things done that they can do, which also involves employment.
Yeah.
So we encourage our people who do have disabilities but are able to work, we encourage them to get back to work and actually even help them to look for work.
Yeah.
And if they are unable to work, then we ask that they please volunteer in our community.
Well, why don't you give your phone number one more time?
Our phone number is 841-2580, and our fax number is 841-7066. We certainly would appreciate any help we can get from our community.
Okay. Well, thank you for coming on, and thank you for tuning in. We'll catch you next time.
Thanks so much.
I'm here.
I'm here.
I'm here.
I'm here.
I'm here.